Hello and welcome to our program. My name is Russell Brand, President and Founder of Live Simulation Solutions, and I'll be your host today. This webinar is intended to show you what we do, show you how we do it, introduce you to our new VBP simulation training, share with you client and simulation feedback, and we'll conclude with final thoughts and contact information. Let's get started. Our mission is to provide training for workers in the healthcare industry by creating and performing live simulations with specific, actionable, and repeatable feedback in a safe, comfortable environment. Simply put, Live Simulation Solutions creates live role-play interactions to address your organizational needs. Our simulation process is based on the standardized patient paradigm employed in the Step 2 board exams, experiential learning theory, graduate research, and deep experience in the simulation field. This background ensures our process is researched, relevant, and effective. Properly designed, a simulation can address all 6 of the competencies designated by the Accreditation Council for Graduate Medical Education, as listed here. Our simulations all involve standardized patients. But what are standardized patients? Standardized patients, also known as SPs, are specialized performers rigorously trained in performance and feedback that portray a vast array of pertinent organizational circumstances in a true-to-life fashion for training healthcare-specific interactions and situations. Simply put, SPs will be the actors your organization will interact with. A major managed healthcare provider wanted to develop a workshop to help educate their primary care physicians in dealing with persons with developmental disabilities and their caregivers. LSS worked closely with the organization to delineate their goals and objectives. We then partnered with their subject matter expert to design and create a didactic and simulation that were complementary and synergistic. We give participants a base of knowledge in the didactic and then put that knowledge to work with a live simulation. Here's some background information on the clip you will see. You're going to meet with Phil Green. Phil is a person with developmental disabilities who hit a coworker and needs a note from his primary care physician to go back to work. His sister, Carlene, is his caregiver and is accompanying Phil to today's appointment. Your task as their primary care physician is assess Phil and determine whether he is fit to go back to work.
I want to go back to work.
Okay, and I have to see about that. But I want you to feel comfortable and feel good at work. You know, I want you to be
Doctor, I'm
happy
sorry.
there.
I can't. We need to get that note for him. I mean, maybe we can set up some sort of you know, somebody for him to talk to when he's back at work. But if we don't get that note today, I don't know what I'm going to do. I mean,
I will speak to somebody. I will today, and I want to get this.
Feedback. In any experiential learning paradigm, immediate feedback is a key factor in participant learning.
So yeah, absolutely. Just a few things that I noticed. I think when I brought up the psychiatric evaluation, I was clutching at straws. You know.
Live Simulation Solutions knows that honest, unfiltered patient feedback is data that is near impossible to come by. We standardize and train our SPs in our proprietary LSS feedback exchange system to guarantee that feedback given is specific, actionable, and repeatable. Our participant will be able to take our feedback, internalize it, and then use that information in a similar circumstance in the future. If they can't, we have failed to furnish quality feedback. Our SPs answer the question, how does it feel to be your patient? Additionally, our job is not that of teacher, but rather to be a partner in discussion and a rich data source for participants. This structure is in place so that participants leave our simulations feeling energized and empowered, not criticized or critiqued. Real-time feedback is given not only from the SPs, but also from the facilitator and the audience, giving participants true immersive feedback. Recorded interactions can be made available to participants for post-workshop self-evaluation. All of this real-world experience with no real-world consequences. In addition to your own organization's metrics, these interactions will positively affect patient satisfaction, patient compliance, patient comfort, doctor-patient rapport, physician-family rapport. An increase in these metrics will lead to reduced litigation, reduced medical errors, reduced patient complaints. Here, we've provided an abbreviated list of possible simulations, such as medical error, difficult patient, and drug-seeking patient, just to name a few. If you don't see a simulation you'd like to run, remember, we can design anything you can imagine. We've talked about what we do and how we do it. Now let's move on to our value-based purchasing simulation. With reimbursements directly tied to patient satisfaction, healthcare workers have never had more impetus to improve their interpersonal skills than now. Our newest product is designed to address all the interpersonal metrics on the HCAHPS survey. It is called Uncontrolled Diabetic with Cardiac Symptoms, Hospital Stay. This simulation gives participants a real way to practice important interpersonal skills that are tied directly to Medicare reimbursement metrics. These metrics are doctor-patient communication, nurse-patient communication, pain control, explanation of medications, and recovery information given. Additionally, we can look at your current HCAHPS scores and augment our off-the-shelf product to address your specific organizational needs. If our generic case doesn't fit your needs, an entirely custom simulation can always be designed and delivered. Frustrating some, VBP metrics were put in place without directions or guidelines on how to improve their scores. This can lead to inaction and continued loss, or can inspire innovation and organizational improvement. Live Simulation Solutions is the innovation your hospital system needs. Let's finish up the program with some client and simulation feedback. The Chief Medical Officer of United Healthcare Community Plan of New Jersey had this to say about our simulation dealing with persons with developmental disabilities. The program was very successful, which I attribute to the painstaking attention to detail exhibited by all the LSS staff and Russell's leadership. Most importantly, our physicians are now better equipped to deliver high-quality care after getting feedback that can only be gained from the simulated patient experience. Chaplain Services of a major health system in the state of Delaware contracted LSS to design and perform a simulation dealing with fetal demise. The director of Chaplain Services said the simulation was hugely successful. He also commented that our SPs were really well trained with feedback that was right on, meaningful, straight, honest, and really powerful. Simulation participants said these were the best parts about their experience. The ability to learn from others and to have feedback right after the experience. The opportunity to receive feedback and to retry a given moment in the practice of caregiving is very helpful to the learning process. This was an amazing experience. Though I was anxious about it at first, I think having this available has both affirmed and challenged me. A great educational tool. This kind of feedback reaffirms the quality and effectiveness of our product. Data like this is undeniable. Ladies and gentlemen, that's our program. Now it is time for you to contact us. With litigation, errors, and VBP rules cutting huge chunks of your budget, it only makes sense to do something about it. That process begins with contacting Live Simulation Solutions right now for a free consultation. We will work with your organization to assess your needs and provide an effective hands-on training solution, all at a minimal investment. Call us now at 267-226-7813 or email us at info@livesimulationsolutions.com to schedule a free consultation. You can also email me directly at russell@livesimulationsolutions for any other questions. For more information about our company, please visit our website at www.livesimulationsolutions.com. Any message will be returned within 24 hours. We look forward to hearing from you and creating a partnership that increases the quality of patient care and bolsters your bottom line. Thank you.